an oppressive yoke around the necks of most Kenyans, and its most punitive effects have been felt by vulnerable people, most of them at the bottom of our economic pyramid. The COVID-19 pandemic, for example, not only brought home the intense local impact of tremendous external shocks occasioned by disruption of international supply chains and markets, it also revealed the limitations of the prevailing economic model and exposed the full extent of the nexus between the state and citizens. For those who had jobs, majority of whom were in the informal sector, the prices of essential commodities rose beyond the purchasing power of their incomes, demonstrating the precarity of the majority of our people's livelihoods, and serious illness brought with it the ever-present threat of poverty arising from exorbitant medical costs. Although there was opportunity to use the COVID-19 downtime to increase agricultural productivity, subsidizing farm inputs was not a priority compared to vendor-driven pandemic-related expenditure, which eventually failed due to wastage, corruption, non-performance, and delays. Other measures and programs undertaken during this time exacerbated the suffering of Kenyans at the bottom and made many people question the priorities of their government. This was the beginning of the national conversation that subsists to this minute and has anchored robust engagements which defined the last election and subsequent political and policy discourse. The primary bone of contention is, who does the government work for?